Talwa siya sorah malungil kapasangay ngil tutaw ngil odosong moraro kulad mluwek katel bululad solat tegin sel time guk lamel boda sispra updates ra COVID-19 mangaringar gestelgidel bo introduce tira edol ma direct liter mahti mortegi de sola wa alia callback arkida 488-4848 sida callback number so la kulturge kumama kilngum sa either return ma uben edol me belum ura program gidral kapsangay okay na ko line edon
okay kamal masawle tuli ka kamal masawlar adra dias broadcasting ma eco paradise marugul atal tira o bangkit al kasus kadamo mulra talk show gid amang mamong arite incident commander gid el maskida gel cook updates usual updates ra response tuli yang ngarinya terul toktangal ngartiang mastir ka ka part trustee mel kom remember last week am laring sel cook trustee mel mlera talk show gid tir ka PSLR so to plan replace sel first sel team mel nga sergi del lurere del respond del mora COVID tira terul toktang tartira Dr. Cicely Wang kang toktang nga hawal May mangaring ya Dr. Merle Hillman nga rami ni Sotal May tira nga toktang tira trauma surgeon intensivist tel akor omese tuli ka tirgal ko mal hido ya raktir mal ubeng ang medical situation still. So tira nga ng tamong ya cellable temi reto din mutel ko kora maskita ko maka el background still may gel ko ka experience still ba observation still el alngarbelaw.
What say?
Malway se kada mamorarite.
Okay.
William singe tulik. Oo, yagi dirak kaldew mas masumong mo da kalsal tira nga rami kung kagimal ko.
Oh, di ako mark clear.
Okay, malungin.
Okay.
Elang dito ko radi ma-update ra LLC test. So, LLC sa gidra halas report sa gidra silog da sira Friday. So, awriw lara ong diam sira Friday ra 3:30 PM. Afternoon al may LLC sira 3:30 PM. Ngaria 432 test talble da conduct 432 COVID test so ayagi del 432 test del milgat smokers ayagi del al COVID testing center ma ER ma ayagi del community center community health center and 23 lebes del positive cases.
Okay,
so 23 mangsel dungura ya ko kumle recovered tirigel la mongi lang 45 ngaya 45 buk la clear isolation malupit na mongi ra COVID masel waise ko mesa arrangalela recovered am la mo 3600 story.
Okay,
segi del buk cumulative maluben igen arrangalela gay sergi del mail al sils am la mo 3922.
I see.
Balgula se sel da do mesra gel dong la seng active malubin tirgel dirgasmer 292 so 292 active cases as of today se mosel go damre kara tok shorgi dia abol maumuot ta bidi se gel al book update ra cases.
Okay,
Ada dira klulway sa laseng lariya omra el mora Southwest Islands rar ada al mlombrus marmlo o test.
I see.
Mestera lebong yang mlos teriral merusra Helen Reef, Coral Art, Tobia 22 la, Pulwana 22, Masonsorola 18. Marang alila ura 66 adra Southwest Islands hamno sabarin merus laring yar pustos o masim del tiram le boosters of palmosti. Tirga rogul al test raigel belu timle negative mang el alta men sa vedal mulwasen dia ka arak Southwest Islands alu bendir ka atal musmer al positive ngara Southwest Islands.
I see.
Ma dire kalmal mga sulira harad ma olengi takla ni selfie wasel mo korak plan na umrael al murayel belu edi boto garikla umila ave mga test make sure malakam sel musel obo ni practice ay gidel preventive measures mo mas kila hapon omgedra adra bulu.
I see.
Tidak kalngarnya umaral mel al trip parel al week al mura angaya ura Wednesday mamurang aya ngalara Friday. So sel trip paregi del mura angaya ura el al Wednesday amo merus aradal mo kadira kal mo sabedal mutal test mlania umaral sira Friday ngania stokta arnur sel mura angaya ura mo test. And then el muta umray Wednesday el mo el mo o test and then provide orus yegidel sedel merusra first dose mar second dose malube kada mastrira boosters.
Okay.
Agure lo bangela akapar norma kabal mentra ngaya urel mo o sabel ngari segidel umray el almil Wednesday. Ako ka Friday and direct kal ngari umray el morang ayang lang ngari trigel midrus so kadam lorang ayang al dire ka manganya pending ongerul daw certid mangmunganya umaral mura ang ayang al Friday lemlamot te miru upmalar se givel secondos
I say
adi daw sperte givel se al de maklas ka still givel mirus rang ayang al wasay Friday nganya umaral lehong is mumrus
I say
el ang dia ka yagidle 0.6 mosmer ra COVID ngaringiyawan al newing al ngamlen newing al kukungot al raktel awul enting positive ra COVID malul mangara isolation ra hospital.
I see.
Hindi sa dalo isolwase akluku eng dia ka ngaring open na testing ra sele community testing center lo mura story ra sulta mo 11 dori aling di hafte ra kluku en di selfie 4 close mang dia ar toktang hindi nganya testing may dira kalmal tol mitrara dal wasal tumumpo mo ngariya ko ra symptoms sa kami so test mo takangal me la mo nilal mo o afternoon al mo o ultitra mura afternoon.
Oh, I see.
Dirakal Wednesday kuay salwaseng blogo el dia mal adal mira testing raway sa idal wabal ngilawig mang kada mo close ra sel Wednesday mang mo dia ka testing ra Wednesday dia ka yagidale C4 malumin dia set clinic ra COVID ra Wednesday.
Okay.
Mo el alwig ya Wednesday sa kada close. Hindi ka dira close salwaseng al suma adang malsmer en dia ka do Robertin mal sabari del mira mas sabari del mira OPD. En open na Wednesday. Hindi liya OPD close ra klugo kal Tuesday leng holiday.
Oh, okay.
O kada observe ra holiday ra klugo ra OPD man close sa OPD ra klugo. Hindi testing segida testing ang aring sel tutaw right tori almo 11 dori. Kada mengel waseng bato ka activities al maral makadira kaldio maklat ke tuli seldo mesra beluar ada kuram lamu terkakla bato ka ay gayil kor ondi bela et kora bato ka ondi bela et tamong et yakal sal kora observe ay gayil preventive measures bela tolgoy kada mengel wasea agay samlamral merio hindi kita telo mesel wase maral merio hindi bir kangaringi yakal blal bola kal completely india daw takangal wase ti daw takangal mutal di practice ay preventive measures to ko ni especially sum ka kokoramal asiro kalsmer ela kabum tolerarat la kapurase kata ma even though kamla talbom ser please edim molmol mal practice of preventive measures lenya ka do tingay sumang kadam tingel wasaya sumka natalom sera tara variant sa emal mosmera tara variant hindi kalbul kula wasay kamla mosmer mal tigyam lutal mosmer virakal dogi utay do ay sa say kumkwari mbala sa kadam lesson da ay gali specimen ergi del mura CDC mo sequence 14 al specimen able descend din kawan na bladong wa result ringim na mo sa bedel mesar al sela system no sa bedel mesar el al sil selwasay one at least one raigel bedesen del specimen el mo Omicron el segi del sublineage el BA 1.1.
Okay.
Yeah, so segi de gida dir kami raigel sequencing raigel mutel dortin.
Okay, delta dirga hal main din digital Omicron.
So, come remember last year, I get first the 2 cases last year, August, amle Delta.
Oh, okay.
Yeah, so we had Delta last year in August, at least in August, I get the first 2 cases.
Okay.
And then I get the case I get January.
Oh.
So December January. So those cases that we sent off, at least one, bladong sequencing ringil Omicron BA 1.1.
May lakar di mingir AB.2.
BA point na yakataplos.
Diya, dito nga lang nungo malakal may.
What say? And then gidira klo ay salwase. Namos yaka maladal mira umrus. Terat offer flu shot and dira kaldim le dori 5 adal me. So man no pasar adal me kalbil nga urus. May lalwi gan ka umrus ka pas. Dira kaldi kya pas yorgit kadam dagel wasta kaduradi mga smoke lergit el girela ocean sa may gal venue sergida kura dongot smoke lel girel tel klolon bibla mang lalwi gen en lamong at ay gidele vaccination. Ting agi momruler ngil wa tirgel every week at tirgel mlamay for social giril memla second dose agi bomom godong ortira schedule time at memrus.
Okay.
Tira kas kumarada sorry mala booster tir agi dolingit elwase memom godong ara hotline say gidel 4880555. So milom godong ara hotline kada scheduler kami ko me emrus. PLL Friday already got the schedule PLL Friday for the oril mo 6 stories. The community health center across the corridor. So he did for the oril to 6 stories. Ya ada sa el walk in el momalara abuster ni and din jakal ngaring tirgel second dose ang tipo mo ko tong still remind the still mat sa momalara second dose Friday.
I see. Nga ka Aklora Airport ra nga rawan 12:30 ra kasus load siwek le meral to ilan molgoy ndi ako dingel wasarado mesa disela agil positive la meral medio but automatically feel or think that it's safe enough pel ngutial maskal moroid lesel tirgem la airport ako mesa tire ndikli bikra vital dingala adetial ngrela open actually se hoy etia Yakim lang masyat. Ela siya katumakarado the reminder adala sa oy kam lang masyat ni seven mosme and dito message segid li disira adre ela positive el declining. Oh, metar automatically di til diagnose tel abdangire mergo mega decision as namo safe enough for tel el masker gin the answer as no. It's still not safe enough. Why say ya?
Why say oy. Dia kalbulgula wasan maral medio manglamodia padirak el mitrar agradil bolgarikla edi taklakare dia kalsar el mal di moy tay dangal el bolu ulen kukka mutel moria au rice rake sergir
why say
so tuliran din lay gidya update nga
gamlu to do resell tela la positive reported el positive tela
so el alsil sa number positive at 23 pitriel PS el mlo al positive
auto kia rogun tela sa total
so accumulative tirigel rogun la mosmera 3922 tirigel mla recover the 3600 tori ma active cases el alta ma 292
la medio
so tirgal 292 adirga sabari loy wali mora tara tirga al bolser why say matirgay del 23 البس el milvang el alsils asabari ra contact certir el lugo nya se temo positive So, gira dal dir ka careful and kal bulgula wasting maral morio makadamo.
Okay. Insa demo ti alcohol ng ngar ngiwal?
Makabong.
Okay. Kabo yung iwal?
Baluin ko sa naka katulik.
Ngil ko
sa ni. Ko na IC ba PIO? Igat to salat.
Amo kara.
Ngil ko sa bortis.
Oh, ngil ko sa ni. Kan may question ra ka.
Tagis. La kuliyasin ang sa full dose ba? Iwa din ang full dose. Ela ko ba magtates ti ba? Pa yo gel wasi. Ako full dose wa do ko dawa bustes. Edi dia bulgula kwase. Ablago ba dia bulgul da test gila di ba wala test na tong sala sergi.
Kamla usa question edite?
Oh, wase ang sa dal mo nga test at sum di so dal chigit.
Oy.
Ngway saying mal sukum ko even though kam lakadan nam siglo say even though kam lamrusel namaya gal require dal dose raw lang booster raw still in sab ml mosmer tehidal especially tehidal omicron mang sab ml mosmer ngi men sab ml motes di ka lo mal asir ka wal sum ko ram lam mo ngi gidal symptoms di blood osad emdang alqal wasaqam lo troira adal di kam moding star still waset tilgat tasmeren di alser malube kam le troira adal di kam mask dimla kam gargikle en kanya tele mel mos merong mal sab ml test.
Oh, okay.
Okay.
Ada ibo esuli.
Apo.
Kaya ibo. Kaya update terus.
Update.
Tilo la string baru tweet logo.
Oy.
Tadi up to Roswell. Blawi kabel. Tilo tabla dia sebel asis tiga gitu blawi kabel. Al di atal la orus. Agar bodol be aku kogel wasi. At awat tiga yun, di blanc la orus, le sel domeses, tara yi la orus se bosper, ari la orus se di mas, di blanc la orus se mas, oka di orel wasi. El awat tiga yun la orus guk, bosper embla rigabes. Tiga tagarap di blanc graf se rak ta ukpal di blanc bolsel, sa skagi da. Baru harus terlihat.
Kamu ngadak MD ka kabong.
Este oi pai raungil lagi dal abai ko raungil sekwe balu beng raungil te ale da transfer nya al mortirgal MV etuli.
Okay, kabo.
Ya kabo ela kabel ko tora meninggal mas. Ali timlahe kabo. Okay. Ela se question ngire lang har titirgal MD mboro sauder ni.
Oh,
okay.
Tuli ka bere halle the borstir mel goras mo al start el masabe maybe tamol answer a question ra ngaruba karang iwal.
Why say?
Tigim la lusi a question mal sugu munde al bol dali.
Okay.
Gioget tit.
Tilagi.
Bol vai say. Mada Dr. Hillman and Dr. Wang. So maybe one of you can start off.
Sure.
Okay.
My name is Dr. Moreau Hillman. I'm an emergency physician in St. Paul, Minnesota United Hospital. I am the team commander of the Minnesota Disaster Medical Assistance Team, which is part of the United States Health and Human Services. We are 14 personnel here in Palau, including Dr. Wang, a PA, 3 RNs, 2 medics, a respiratory therapist, logistic personnel, and an administrative personnel. Our mission here is to support the Palau National Hospital during COVID surge. 6 weeks ago, the numbers in Palau were very, very worrisome, and it was felt that the hospital needed to have additional support in terms of personnel that would help run a COVID unit and to decompress the emergency department if it became very crowded. Fortunately, the first group that was here dealt with the surge, and the numbers have gotten much better. So our job now, in the absence of a surge, is to prepare the staff to better treat COVID if a surge comes in the future. In Minnesota, we experienced COVID surges in October of 2020, and then in November of 21 with the Delta variant, and most recently in January and early February of 2022 with the Omicron. The Omicron variant is very contagious, and although less serious illness than the Delta, many of our staff became ill, and there were staff shortages resulting in emergency department overcrowding, bed shortages, and stress to the healthcare system in general. Over the past 2 years, we have learned many lessons on how to care for these COVID patients and have more tools to lessen the effect of COVID, including vaccinations, monoclonal antibody infusions, and antiviral medication, which prevent hospitalizations and hopefully prevent death. Fortunately, you have done a fantastic job in vaccinating your population with a vaccination rate that's 97, 98%. And I encourage everybody who hasn't had their second vaccination to get a second vaccination, and anybody who's been 5 months since their last vaccination to get a booster, because in Minnesota we found that really helped. We have learned best practices in hospitalized COVID patients, which we hope to share with the medical staff here, so they can better deal with the COVID surge that we hope doesn't come.
So maybe I can ask the first question that came in, since you mentioned that vaccination and boosters, including boosters, being up to date with your vaccines is very critical in its role in preventing severe COVID and death. So this person says,
COVID. No, not okay.
So this person says, I took 3 doses, so that's first, second, and third dose. So this is an immunocompromised individual, but they tested positive and recovered in the last. Well, she wasn't specific. Do I still need to get the booster shot? That's the question.
They had two vaccinations or 3?
3. Third dose. So this person was is immunocompromised, so they required a third dose instead of a booster. But then they tested positive and recovered. Do they still need to get the booster shot if it's their time to get the booster shot?
Was this person's third dose considered the booster?
No, third dose.
Third dose.
Got the third dose, so the full dose.
Well, first of all, I just want to say that we had hoped that the vaccine would prevent anybody from getting sick with COVID. Unfortunately, that hasn't been the case, but it has prevented many people who catch COVID from getting very sick and requiring hospitalization or dying. So, although it's unfortunate that this person, that you had COVID, it's fortunate that you recovered and hopefully didn't require hospitalization. Immunocompromised patients are kind of a special case. Do you want to?
This is Cecily Wang. I'm an ICU doctor from Honolulu, and I say when it's time for the booster, everybody should take the booster, and it's especially important for immunocompromised people.
Yeah, so I guess the general guidance from CDC is that if they got their third dose and then 5 months later they can get a booster. So say give the tuliga and settle more question. I was say even though you've got COVID, you've recovered, but 5 months out of your booster, I mean your third dose, then you can get a booster.
Yeah.
Okay, but if I wanted, I got 3 shots, Pfizer or Moderna. If I got complete my shot, 3 shots, right? But I just want to make sure that I'm not going to catch this disease. So I go and ask for booster. Would they give me a booster? And if I get the booster, am I going to be much safer than the other people that only got 3 shots?
The question is, can you get a booster on top of a booster? So that's different than a third dose.
Yeah. What I'm saying, you got 3 Moderna, for example, right? But I said, well, if I go and get a booster, I'm probably going to be, my health going to be much safer. Okay, so can I do that?
So So let me just answer, as other Belawe, so the Palawan context. If you come to a pod and we have your vaccination records and it shows that you got your booster.
Okay.
It's you a booster yet, because the guidance is very clear from CDC that
right. Okay.
Not a booster, you can't. You're not up for a booster yet.
Okay. So what are you saying is that when you come in, they look at your shot records or card,
yes.
And if you got it, then they're going to tell you they're not going to give it to you.
Yes.
I say.
Yes, that is correct.
So this is Dr. Wang. That answer is correct, and if the person is asking whether, if somehow, if they're able to get it, is it going to help them? And the answer is no, because it's already in your system. And if you're within the time range and you got your booster less than 5 months ago, getting another shot is not going to make you super protected.
Yeah. Okay. We all make a mistake, Dr. Wang. We all make a mistake sometimes. Like, for example, if somebody made a mistake, I already got 3 shots, and then they give me the 4th one by mistake. Am I going to die, or I'm going to suffer, or what?
No, but you're probably not going to get any benefit.
I see.
The fact that you had COVID after the booster means that you had even more immunity than before. So it's not necessary.
Okay. Well taken. All right. Okay, let's continue.
So Dr. Wang, can you?
Yeah. Okay. So I'm Cecily Wang. I'm an ICU doctor and I'm a surgeon. I live in Honolulu, Hawaii. And I was here with the trauma critical care team in March 2021. And what myself and my team noticed was that, well, the first thing we noticed when we came here was no masks, because there was no COVID here yet when we were here a year ago. And what was so awesome about that is, well, last year we could say we felt Palau was a year ahead of us. And now you're almost 2 years ahead of us, maybe not quite exactly 2 years. And how I count is we've all been in this pandemic together for over 2 years. We've been globally experiencing this pandemic together, but what I'm counting is when the first cases started, or the first surge started. And so back in the U.S., it was March 2020. And in Hawaii is March 2020 when we first started seeing COVID patients. I was out on a mission with HHS in California. I came home in late March, and we had not even a real surge. We had several patients in the ICU, and everybody was scared. Back then, we had no vaccinations. We really didn't know much about COVID. We were, first we were intubating patients. So I can speak mostly about ICU patients because I work in the ICU. And just because I'm talking about these super sick ICU patients, that's a very, very small percentage of COVID patients. It's just the patients I see. My friends in outpatient see the people who are, being treated as an outpatient or who are isolating at home. But 2 years ago, we were learning everything we can. And the people in Palau were learning from watching everybody else, watching what we were doing right and mostly watching what we were doing wrong. For example, we were at first intubating people too late. And we found that, by the time we intubate people, they were already so tired and so worn out that it wasn't going to be much help. Then we were intubating people very early. There was a while where we said, when the patient reaches 6 liters nasal cannula, we should think about intubating. And we were doing that. And then we finally found that it's really somewhere in between. And the docs here at BNH and the nurses, they know that from talking to the colleagues from outside. So this is what I mean by healthcare system here and the EOC here and the MOH here are 2 years ahead of us, of the rest of the world. I think it's really like impressive that the vaccination rate is somewhere around 97%. And then COVID came. So what I'm saying is we're here not because nobody here is in trouble. We're here to kind of because we have experience managing COVID patients in our hospitals, and it's probably helpful to like tap onto our experience.
Okay, Dr. Wang, can you entertain this call just came in?
Sure.
Okay.
I can take it.
Ya malulom se komene pal korang doreng se mo klo ulum momrereng mo yak prengs.
Oi.
Diesel agari ka wasi ka mamel el old age en le hotel mala oru tem lamo hotel siata gimara madre na gidir ke komala booster.
Okay. Kami se rite.
So al sugum kangilu first second selong ederga al sugum nuklo se third dose and then in emel mewa booster ga al sugum lamo 5 months after the third dose and dil sugum kangilu booster selong edel lorusa booster and dirga ba mo speral mutel booster.
Oh, dia kan jim lagi mo booster aki dingira dur dosra mother nara mam tigel 7 ogi mother ngira mam.
Palsugum kangilu dur dose emlamo 5 months and sab emel mewa booster ka.
Oh, melaki to amal kol hotline me ka schedule.
Paise komti kol hotline o gore rula appointment sa kami me malari.
Okay, gomal masaule.
Okay, meiga.
I think it's very confusing for a lot of people in the world, in the U.S. and maybe here, that, well, we're so well vaccinated, why are we still getting COVID and why are we needing boosters again and again? Well, it's because the virus has been mutating. So when we first made the vaccines are supposed to keep us from getting COVID altogether. When we first made the vaccine, it was very highly protective against the strains of COVID that were there when we made the vaccine. And unfortunately, it kept mutating around the world, and now we have this strain, Omicron, where the vaccine offers protection, but it does not prevent us as much as doesn't prevent us from getting it as much as it did with the Delta variant. So this causes a lot of confusion. It caused a lot of confusion in the States, and maybe it causes some confusion here. And also, why do I have to get boosters? Well, we're finding that, like, we get flu vaccine every year. We're having to get the COVID vaccine after 5 months. And in the future, I don't know, it may be once a year, it may be twice a year, I don't know yet. It's going to be based on CDC recommendations and based on future COVID variants. I don't know if that answers the question at all, but I know there were a lot of questions about the vaccine and boosters.
sabele gitim kora osi isel piginya la kaltoktang maldir ka swada lutel butokal other belau el dir ka giril memala booster tis belanga ya booster tis lengal toktang amal kol masay ar adal amos esel garangri remo o gerek masay ngara ul magidi malaikal yopo igal lorus mang sera kotlo mu lel kat maklitel vaccine ra covid en mleungi leleng ang guk morsel mle qotal kol covid sel qotal armela covid tiam lamo mqater tamang mla chance mutate tamang igal vaccine sa qora mlamo triple mi it utel degal prevent tra Aser, tindir ka sa ello nga se will prevent kukura mal mohido mal ube ka mata stial COVID. Di sa lolo ko niya kasi over time ang motalgibal nga riyo immunity ra or tegi del racks mang mal important ta obe mga booster sila kami. So mamal kuk nga public health mal mga lera rogul adra buluk masay selbla sugu momlamot teme mala booster sel gim open ebe mu yal sugu mendirga ge mom kodong ra hotline em schedule ra teme men hotel booster lendir ka buto ar adal ngara al sela bulul dirga al giril mala booster tin din dirga kalmu
ngai say Tesel lo meseng in diwai a case rase o a seat belt ase wear your seat belt ndi al karentil ase o mo seat belt ndi akoma ndi sebe ngo sugawa in case if you run to an emergency, right?
Right.
So in other words, it's working like a seat belt,
yes, it's a layer of protection, like a seat belt.
Yeah, but it doesn't guarantee you that you're not going to die when you have an accident.
Correct.
It's just going to help you to minimize the possibility of getting killed out there.
Yeah, and if you have a seat belt and you also have an airbag, you also drive under the speed limit, and that's 3 layers of protection.
That's right. That's right.
Yeah.
Okay, let's continue on.
Did you have anything else? There's another question that came in, maybe while we're talking about vaccines and protection and all of that. So this was the question from Yuval, I think. He was asking, we have these people we have a fully vaccinated community, people are vaccinated, but then we have some people or a lot of people who recover from COVID, they have mild symptoms, but then we have people who are vaccinated but got severe COVID or died. So maybe you can just talk about some of the, why do we see that variance? While some recover, others get severely ill and die, including those who are fully vaccinated.
I'll go ahead and get started on that. Certainly the vaccination helps lessen the severity of the COVID, but people who are vaccinated sometimes do get very sick, sometimes need to be hospitalized, and sometimes even die, but a lot less than those people who did not get vaccinated. Usually the people who get very sick with COVID, despite having the vaccinations, are people who have underlying medical conditions, especially diabetes, especially heart disease, cancer, they're immunosuppressed, those are very overweight. Those are all risk factors that make it more likely that if you get COVID, you're going to get sicker, but the vaccinations will help make that risk less. So I think that's the seatbelt that you need to wear.
I agree.
Yeah.
Yeah, it's the people who, it's not anything the people did wrong. People who are fully vaccinated and still get very sick are, like Dr. Hillman said, people with other medical conditions. There are young, healthy people who end up getting very, very sick, and we're still not sure why. Maybe some of it is genetics, and maybe some of it is luck of the draw. We do see that, but very, very rarely.
Okay.
We have to look at other perspectives. Like, if you're not fully active, if you're kind of just lay back, eat, sleep, and play, don't have no exercise, you're not a healthy person. More likely, you're going to catch this. And when you do catch it, more likely you're going to probably die. Because, if you're healthy and you participate in this exercise and be active, I feel like, that also will help you not to get the COVID-19.
Yeah, exactly. You bring up a good point. Some of it is maybe someone who's seemingly a very healthy person, but has a very high stress level.
Right.
Also brings down immunity, or maybe no longer exercising.
Right.
I stopped exercising when COVID started. And maybe drinking a lot more than before.
Right.
Maybe smoking a lot more than before. But they just seem healthy.
Right.
I think also it's very important that when people first develop some symptoms, that they don't ignore those symptoms, that they get tested, and if they're tested and they test positive and they have a lot of other risk factors, there are medicines that they can take that will prevent them or lessen the chances of them getting sick enough to be hospitalized and dying.
Yeah. But that being said, I'm not saying that there's no healthy people who get. I've seen seemingly very healthy people get sick, but very rarely.
Waise tuli mang ngel ruba kada ang niwalay hoping din single toktangal masay waise ngarnyar adal mla may kalorus ending sabirin malmos me ere malubet tamas yari ter sera losada sige yidel kuk mladra balwat kadam lo matikari mas oy ngarnyar stedo per stiril nin lang maya or serir hindi sila ka ngamal ko ra mawadale ngarnya ko rak malo bradal rakpil sige yidel ko ra ide ang raktela heart malubeng sukal malubeng sawa tirro ko il mlamata sayidang ide tamal mawad malubeng ngarnya ko ra mal klol raktira ul man direct al contribute del mora ako del lead.
I see. And also I'm strongly believe that if we we eat our own diet, own food, if we eat our own food, because our system, I think for some reason they're expecting us to eat taro and fish, food that we have been eating for many years. Yeah. But nowadays we change to eat American food, the Japanese food, other food, and for some reason our body are not responding, to those kind of food that is kind of foreign food, which is not providing, protection for our system, So I think if I eat my Palawan food 90% of the time. I eat Palawan food when they are available. But if we all eat our own food, Palawan food like taro, fresh food with no additives and no preservative, because when you import food to anywhere, especially when I was in the military, we import food to feed the military out there, and come to realize they also use a preservative to preserve the food so it doesn't spoil. At the same time, they put additives, which is not good for you, and that screw up your system. I hope I'm wrong.
What we put in our body is very important. So what the food we put is very important.
Right.
I agree.
Oh, one other thing is, I've seen some healthy, what we think, previously healthy doctors and nurses get very, very sick from COVID. And because I work around them, and my theory is they're so tired from so much work that actually makes their immune system lower.
Okay, can we get this call from Iwal? It's the same guy that want to have so many questions. Kabo nga rin lalo.
Tuloy.
Oh, ikaw.
Ako kayo kasi. Alam. Nakasumer. Suguba. Reactive. Tababa ko ikil pa doktor.
Okay.
Sumer. Barbering lang. Kasi kaya di ba pala na orus?
Meron orus lang nga.
Kaya bus. Kaya orus na COVID.
Kamle accident mang bringer oil lang kamle accident.
Pwede ba sa bringer? Didira po orus sa sumer ba orus?
Kung nause idol. Okay. Kan summarize ringi gulas mo summarize.
The question is so he's using a scenario.
It's the same guy.
It's the same guy. If he was recently in an accident, so his leg really hurts, he's in pain. Should he just go ahead and get the COVID vaccine?
Is it safe for him to take the shot?
Yes.
I agree.
Oy, sila kita mula sing maldir kasi elal suku mung sa el ku kotukur tiadring level ola ringin dia kangaral tomalil al sabatangel.
Di selorus dia kal fix tial mering rabdangel lesek asum klita el ngok malara imor orus. Dia tial COVID Moderna malu Pfizer fix tial mering lo. Ako mo confuse lang. Mle accident mering lo mergo mo malar tial orus ngant ta question niya se mang help pertiang al obeng ngarial tamlia sum tialo iga mering mle accident ek mo orus seng sebet tomla al obeng dia problem. Dito ako daw sa tinasira sa problem. Go ahead and take the shot. What I say?
May say hindi ka matamal.
Okay, that fellow right there is we work together. We have our own television and radio show, and a lot of people are calling him and have him ask the questions on their behalf.
Okay.
Yeah, that's why we hear his voice every now and then. Okay. Okay. We got 10 more minutes, ladies and gentlemen.
So maybe you guys can just share a little bit about, or maybe if you have any recommendations for moving forward, seeing how we are right now and what you've experienced in the States, what would you say?
What's your advice to us, the Palawans? Are we doing okay with our programs? Are we, complying with the CDC requirements and all the preventive measures? Are we doing okay?
Yes, you are. We're very impressed with your guidelines for protecting your country, and when we come in, and the restrictions of movement and the mask wearing is pretty universal. Vaccination rate is very good, and I think that's why you're not seeing the spikes that some of the other places are seeing, and I hope it will continue.
Right.
Yeah, I agree. I was here last year and this year, and both years, I from what I see, Palau is relatively prepared compared with many other places.
I see.
And what I think helps is the people are vaccinated now, and the hospital staff, the Palau National Hospital staff, the doctors and the nurses are highly skilled and also very caring, because their patients are their community, their family, their cousins, their uncles. So I see how they treat their patients like family, which is helpful.
Yeah. Our frontliners are working very hard. We've been doing this over 2 years now, especially Edom and Rita. We've been working together and disseminating information to the public. And I strongly believe that strong media here in Palau what helps a lot, because like when they want to educate or remind the public of do's and don'ts, right away, all the media comes together. Just like tonight, the government-owned radio station and my radio station, we together and broadcast its updates to the people, so they are well informed. And I strongly believe that media is doing their job right.
In addition, just a word of caution. I also think that the Palauan people are stoic people. They don't complain too often, and they come in maybe after they get really, really sick. And I think this is one condition where catching it early and treating it early can really make a difference between getting so sick that you need to be in the hospital or just being able to handle it at home. So if somebody has a sore throat or a runny nose, they shouldn't just ignore those symptoms. They should come in and get tested. And COVID can present just like an ordinary cold. And you don't know that you have COVID until you get tested. You don't have COVID until you've been tested. So that's important.
So going back a minute, I agree. The dissemination of information is vital. So the media putting out regular information sessions and transparency from the leadership, all of that makes a huge difference.
Right. Okay, Edom, you heard that?
Yes.
Do you agree or disagree?
I agree.
Yeah, because the media here in Palau is very strong, and I mean, don't do anything wrong, because the minute they hear about it, it's going to be all over the world. Yeah, so I think we're doing job. Are we doing a good job, Edol?
Pero tira kita ko amat tara bela mang madala ko first series tulik.
Okay.
But you doctors mentioned something that feedback from the community. So some people, we can even say a significant number of people, they won't get tested. They would just stay at home and not get tested even with symptoms. So why, can you maybe elaborate on why it's important that, you know, if they're symptomatic to get tested? Sure. Some even say, oh, never mind, this is just a common cold, this is just like the flu. So maybe you can elaborate a little bit on why that's important.
For two main reasons. It's important to get tested early if you have symptoms. One is that if you do have COVID, especially the Omicron variant that seems to be here, it's very, very contagious.
Okay.
It's as contagious as measles. And you might be spreading it to the people that you care about most.
Yes.
And you don't want to do that. If you have it, you want to be able to isolate yourself and to just isolate yourself for 5 days, you know, or maybe at the most 10 days, and then prevent your loved ones and your neighbors from getting sick. Once it starts in the community, it's like wildfire. It spreads very quickly. The second reason to get tested early is that we have medicines now that we didn't have before. The antiviral medications or the monoclonal antibodies, depending upon what your risk factors are, that can really prevent this disease from progressing in many cases. Not all cases, but in many cases, this will lessen the effects of COVID and prevent hospitalization and death.
Okay, Dr. Hillman, can we get this last call?
Sure.
Okay, Ali Gabong ang igual?
Ay, sulangat ko rin kaya ba, chalas ka gol blay?
Ay.
Kalau mo gol blay, pasti. Ilan ko itong pesa tok na mga jogan pasti. Kaya yung BA2, kaya yung BA.2. Blanco blamin ako.
Ay.
Hindi nakatu, meron di ako pur meron. Suela kaya yung 1, 2, 3 dose blanco kan? Suela, mo sugid at kaya yung
Protector kami, ay gagi del plam ngayon Moderna, may gagi del Pfizer, may Johnson & Johnson, and sapel, ngosu kami, wasugum segid, sek dilo as BA.2?
Ay.
Ay. Dilang BA yung AB. Okay, here's the question with Dr. Hillman. Thank you, ang iwal. The shots that we have gotten, Moderna, 3 shots or 3 doses of Moderna and 3 doses of Pfizer and Johnson & Johnson, okay, if we're fully vaccinated, will that be able to protect us in case of that new variant comes to Palau? They call it BA.2.
We think it will.
Yeah, do you think it's going to help us?
I think he's asking the vaccine efficacy from the...
Yeah. So far, the studies show that the vaccines are effective both against BA.1 and BA.2. We don't know as much about BA.2 because it hasn't been around that. We haven't identified it that much. It's too recent. But the early studies seem to say yes.
Yes, okay. Okay, thank you so much, Dr. Hillman.
Especially if you're boosted, right?
If you're boosted, right.
Yeah.
Especially if you have Johnson & Johnson, make sure you get a booster with the Moderna or the Pfizer.
Yeah. Yeah, I got my shot. I'm Johnson & Johnson, and then I went in and got my booster, and I'm okay. I never had no headaches, no backache, no nothing. No symptoms whatsoever.
Hope it stays safe.
Yeah, so I'm lucky. Okay, so... Gentlemen, ladies, we have come to an end of our program, so I'm going to give the line back to Riter or Edom, and then you guys say a few words and say goodbye to our guests and also our listeners, and until next week, Monday.
There's another question, though, if that's okay.
That's okay.
So this person is, can you ask about reinfection, if they've seen it where they work, in Hawaii or Minnesota or elsewhere, and how long after you recover when you can get reinfected?
I've seen reinfection. Sometimes the reinfections that we think are reinfections might be the same COVID from the first time. Yeah.
Long COVID?
So say someone gets COVID in February and they feel a little better, but then they feel a little bit worse, and they get tested again in March. It might still be positive at the same time, so I don't consider that a reinfection. A reinfection is someone who tested positive, was sick, became well, tested negative, then maybe a few months later, or even half a year later or more, gets infected again. And I've seen that a few times in Hawaii. Less than a handful of times that I've seen it. And again, these are immunocompromised people that I've seen that.
I agree. There's the possibility that with new variants, it may start happening, but so far it really hasn't very often. It's rare.
Okay. Yeah. What we want to say is there's no cure for COVID. There are better and better treatment modalities, and these treatments work best earlier on. So when someone starts to get sick, which is why we keep emphasizing get tested early and start the treatment, recovery will be faster.
Okay.
Right. I'm gonna take a question to Tulik.
Okay.
Did you want to have a final comment before we end it? Anyone?
Yeah. I just want to say that it's been a pleasure working here. Your people are lovely, and it's so inspiring to see the willingness of everybody to get vaccinated and care for each other that it warms the heart.
Okay.
I agree. This is only my second time here, but it feels like home.
Thank you.
Okay. Thank you for your time, ladies and gentlemen, and we'll see you next time at home in Incident Commander Retake. Bye-bye you all. Bye-bye.